Welcome to Listen to Your Skin by Moon and Skin, the podcast where science meets nature to celebrate the story of your skin. Your skin is a living canvas, ever evolving, deeply personal, and uniquely yours. Each week, we'll dive into the science of healthy skin, share empowering stories, and uncover transformative self-care rituals. We're here to help you embrace every phase of your journey with confidence and care.
Hi, everyone. Welcome to this week's episode of Listen to Your Skin podcast by Moon and Skin. I'm your host, Dr. Jen Haley, and this week I have one of my dear friends, Dr. Brenda Lutowski, on the episode. She is my go-to person for all of my dermatology needs, and especially my aesthetic needs. So Dr. Lutowski, she is another board-certified dermatologist. She practices here in Scottsdale, Arizona, and she is the founder of Clear Dermatology and Aesthetic Center, which has grown since I arrived here. She has places all over the valley, and she's been providing patients comprehensive, expert dermatological care for over 12 years. She's also founded Investigate MD, which is a clinical research company that has conducted over 75 dermatological clinical trials and has helped with the FDA approval and clearance of many dermatology drugs, technologies, and devices that have improved care for millions of patients. And she's always on the cutting edge of everything. And also, she has formed Clear Vanity, a mobile dermatology service providing luxury skincare anywhere. And not only is she board certified in dermatology, but she also completed a laser and cosmetic fellowship with skincare physicians in Boston, Massachusetts. So based on this, she should be like 100 years old, but she's not. Hi, Brenda. Welcome.
You are too kind. Thank you so much. Thank you for having me, Jen.
Yeah, I love having you. So you've been on my other podcast, and we've talked about so many things that we've seen come and go over the years. And we often talk about cutting edge procedures, and I want to break it down today on like simple things, Botox, other neuromodulators, because these things are, we use the term Botox like we would use the word Kleenex or a Band-Aid or Q-tip, but there's other neuromodulators out there. Like, what does Botox do? What do fillers do? And when are each indicated to help someone with like the building of the house, of the rejuvenation of their face? If you can just start with like how you approach someone who comes into you for a cosmetic consultation. Like if I'm a person that comes into you today and I don't know anything about what I can do for my skin and I want to look refreshed and younger, like where do I even start?
That is a great question. And I think it's very important to ask because there are so many things out there that we can do. And the rate limiting step tends to be patient's time, patient's budget. And so to your point, I think it's good to have a starting place. I usually ask patients when they're coming into the office, where do you want to start? What are your priorities? And I have them show me their priorities, and then we go from there. And I can add in simple suggestions as they request. But really starting with what's bugging them will get us started. In terms of neuromodulators, you're right. There used to only be Botox for decades. And now we have several more. I think it's up to 5 FDA-approved neuromodulators, with many more in the pipeline, by the way. So you're right, and it's a common question. What's the difference between Botox and all the other menu out there? We use Botox. Botox, in fact, prohibits nerve signaling. So we use Botox to temporarily weaken the muscles that are creasing the skin. So for instance, 11s, forehead lines, crow's feet, those are the areas that we use Botox most commonly. However, we can also use it in lower face. And right now, platysma is really big because Botox did just get an FDA indication for treating the platysma. So those are the areas we tend to use Botox and neuromodulators. Fillers, however, can be used to support the skin and the face, to build the house back up instead of letting it crumble down. So we tend to use fillers to support the cheeks, to lift the cheeks, to support the jawline, and to pull the jawline tight. And nowadays, the sky is the limit. We can go on and treat the neck, off the face, off the neck, and so on. But usually, we're starting with the face and going from there.
Right. So with Botox, I always think of it as you're weakening muscles that form lines. So today is day one. So like, what's the why? Why is someone coming into the office? And if they have something in 2 days from now, that's really just enough time to form a bruise and not really get results.
You're right for now, although there is in the works a very short-acting neuromodulator that will probably be FDA approved here in another few years. But you're right. So usually with neuromodulators, they are kicking in 3 to 7 days. And some of them can kick in a day or two faster. So any events someone has, that is a decision maker when it comes to choosing a neuromodulator.
Right? Yeah. I think it's important for people to realize that we're weakening muscles. We're not freezing them. We're weakening muscles that form lines. So there's no solutions. There's just trade-offs, right? So are we willing to compromise the movement of the muscle to make the line go away? I think in the frown area, most people are willing to lose, that fierce, heavy pulling down of the eyebrow in order to get rid of the 11 lines. Now, when we're talking around the mouth and other areas of the face, even the platysmal bands, like Pilates can be hard if you do too much, right?
Yes.
So we're trading off. There's trade-offs in all of this. So a lot of times people will have forehead lines that they don't like. Well, if you weaken the muscle that pulls up the brow, especially as we get older and we lose bone and we lose fat from the face, now we're getting a heavier brow. So we might not have any lines, but we iron out the area, and now the look of a heavy, angry baboon look isn't really what we want at the end of the day. So that's the conversations I think that we want to have about like the pros and the cons of all of these.
Absolutely. And that's why Botox is really such an art. It's really not a cookie cutter approach. And these are conversations we have to have in the office. In addition, a lot of people don't like that really frozen look anymore. That was something that was done way back in the days, as you recall, when we were first doing Botox. Nowadays, it's more of an art. So we're just, as you said, weakening the muscles, and we're preserving a lot of the expression. A lot of patients want to be able to raise their eyebrows. Some patients actually do want to be able to frown. Judges, psychiatrists, counselors, etc. They want to be able to frown a little bit to show some empathy for those in they're dealing with in their careers. So really, it starts with the consultation and education and finding out the patient's preferences.
Right, and what their goals are, because if you even just weaken the muscles a little bit, you can still have a frown, but not enough to have a deep crease.
Exactly.
That's the beauty of it. So I know it was so different when, in the 90s, before it was even FDA approved, we would put 40 units here, and that's what caused the Spock, because everything was so imbalanced in the face. And to your point, when you lose the micro expressions, the reason I always ask, what's the why behind why we do these things? Ultimately, at the end of the day, the reason why we want to look better and show up better and be more successful is so we can connect better with people. And if we're doing anything to inhibit connection with other people, we're not doing a good job as a dermatologist. And if we get rid of our micro expressions, and I say, I'm happy to see you, like, feel that. I have to be able to raise my brow. So, I'm happy to see you, right? Because we do communicate through micro expressions. And I think that's where people have gotten so polarized with Botox and other neuromodulators, is that we've seen so much bad Botox out there that it can be done very nicely as an art form.
Yes, exactly. And it's funny you said that. That is a conversation I sometimes have to sit down and have with patients, because sometimes they come in and they say, well, I can still raise my eyebrows. The Botox didn't work. And I have to explain to them, no, we actually want you to be able to raise your eyebrows. The goal is not to be frozen. The goal is not to make deep wrinkles. And same thing with the smile lines, like you mentioned. The goal is to have lines when you're smiling, but not have them be deep and not have them form permanent creases that are there even when you're not smiling. So 100% agree. It's really an art, and sometimes it takes a little extra education to let the patients know what our goals are.
Right? Do you think how old do you think people can start doing these procedures?
Some people in your audience are going to think I'm crazy, but I would say early to mid 20s is completely acceptable. Again, in contrast to what we saw when we were doing Botox decades ago. Decades ago, I probably would have said 40s, 50s, whenever someone's forming the creases, but Botox is actually preventative. So when we're doing Botox, we're preventing the creases from forming. And when we prevent the creases from forming, the skin also looks better. There's less wear and tear on the skin. So you have two improvements. Number one, the wrinkles aren't forming. Number two, less wear and tear on the skin. And so, even if someone's just doing like a little baby dose of Botox, or they're not doing it as frequently, it's nice to start that prevention early on, just like anything in medicine. The earlier, the better.
I kind of agree. How old were you when you started?
I was in residency. It's all a blur, but I do remember getting Botox before my wedding in residency. But nowadays, I wish I would have started early.
So were you in your 20s?
I was in my late 20s, yes.
Yeah, I was 29 on stage with Dr. Neil Sadek, and he's like, wow, you have the strongest muscles. And I said, oh, I went to Catholic school.
You have always had such a great wit. I just love that. I'm not sure if I would have been able to do it for the first time on stage, but I did do it. Well, yes. Okay. In that case, the answer is yes.
You know, when you're a starving resident, you'll do anything for free.
You'll do anything. Yes. Looking back, I did do it for the first time before my wedding. So that was pretty brave, I think.
Right. You don't have to do a lot when you're younger. It's not the way I look at like daily cost average, right? If you're coming in 3 times, maybe 4 times a year, which how often actually do you recommend people do these procedures? Because there's different products out there. Feel free to name different products. Like how often do most people need to have it done?
I generally give a blanket statement of 3 to 4 times a year initially, but that's just to set a patient's expectations. Everyone is different. People have different preferences. And so, for instance, those who are doing Botox as more preventative, they don't have lines yet. They may be on limited budgets because they're very young. They may have limited time because they're very busy with their early careers. We may decide twice a year. And twice a year is certainly better than not doing it, because that's half of the year you're actually not forming those lines. And then you also have that other time where the skin is still soft and supple. It's recovered from that wear and tear. And so at an early stage, that's an acceptable time frame. As we go on in life, the skin loses elasticity, it loses collagen, it becomes a little less forgiving when the Botox wears off. So I do find after a certain point, maybe somewhere in the early 50s or 60s, patients are feeling like they really have to come back every 3 or 4 months. We can alter the dose a little bit to make the Botox last longer. So I have some patients who are very time conscious. Or for instance, there was a woman who unfortunately had to go through 6 months of chemotherapy. And she said, I am not going to be able to come back, but I don't want to have wrinkles during this chemotherapy. I just need to do something for myself. And so we did an increased dose and she was thrilled. And in fact, she got beyond the chemotherapy, but she came back and said, do that exact same dose because I love the way it lasted. So 3 to 4 months is a good starting point. But again, this is an art, and that's what makes it so fun. It's art combined with science.
Exactly. I know. That's why I haven't gotten bored of it after 20 plus years, because it's different for everyone and it's different throughout their lifetime. And I'm always constantly trying to figure out how to do things. So at what point, okay, let's take a step back, because we'll talk about off-label areas of use if you're comfortable with that. So where can, if you could just point to your face, or you can come over and point to my face if you want, what areas can people use Botox? And when we use the word Botox, we're talking about all of the neuromodulators, because I don't know how you feel, but I feel that it's more about who's doing the procedure than the product you're using. You can change the properties of the product based off of how you inject it into someone, if you're going to someone who's experienced, who knows what they're doing.
I agree 100%. The technique can vary a little bit between products, and so you can adjust to each patient's needs based on the product that we have on hand to work with. So what we can treat on label would be the 11s or the frown lines, and that's the glabellar area. We can also treat the frontalis or the forehead area, and those are the horizontal lines that we see. And we can treat the crow's feet, and those are the smile lines, which again, we talked about having smile lines when we're smiling, but maybe not so many of them when we're at rest and not smiling. Also, as I mentioned earlier, Botox just did get an indication to treat platysmal bands or to treat the neck, which will help with bands and also will help, in my opinion, define the jawline and let the neck drape smoother and have a more youthful effect. Now, some areas off label, and sometimes I feel like the sky is the limit when it comes to
Playing
Botox.
around.
Yeah. But some areas off label that I typically do in the clinic would be the chin area to prevent the orange peel look. There's some muscles here called DAOs, and that turns down the corners of the mouth. So it gives us a frowny appearance. So doing the opposite, applying the Botox so those muscles aren't as strong, will sometimes have an uplift in the corners. Treating here on the upper cutaneous lip will actually prevent lip lines and actually turn the lip outward a little bit or evert the lip. And so there will be a little bit of what people call lip flip. And then also we use a micro dilution of Botox, so very, very dilute Botox, and we can use that in the cheeks, and that can help with excess sweating in that area, and it can also help with rosacea. So really, really fun stuff that we can do.
I love that. I love that. So as we pivot into fillers, when do you recommend someone do, besides the price point, when do you recommend someone do a lip flip versus filler or both?
I love that question because it comes up several times a day in clinic. So if you throw the price out, here is my advice. For patients who are new to aesthetics and or very nervous about how it's going to look, I think a lip flip is really great for kind of dipping your toe into slightly eversion of the lip or making the lip look a little poutier, a little bit more full, especially the upper lip. If they're looking for a little bit more volume, something a little bit more noticeable, or a little bit longer lasting, then I recommend doing lip filler. And lip filler is a gel. It goes into the lips. It makes them plumper. And I usually tell patients the way we start is we try to make the lips look like they did 3 or 4 years ago. So we just sort of reinflate them a little bit, and it's a really, really beautiful natural look. So so I usually start there with the patient, and then we have a conversation and see where they want to go. And you can do both, by the way.
Right? Because if you can't push the muscles, the filler actually lasts longer.
Exactly.
Yeah. So when people bring in photos, like there's so much out there on social media, and you see the photos of bad lip filler or too much filler. I think it's important for people to understand that one syringe is 1/5 of a teaspoon, and one syringe usually doesn't do that. That's multiple sessions. And when someone is doing lip filler, it's very important for them to understand that you want to keep the proportions of the lip. Like in a Caucasian lip, it has different proportions than an African-American lip. So you always want to keep somebody's proportions correct so that we don't get those duck lips, correct?
That's absolutely correct. Lip filler is, again, an instance where this is such an art, but it's art and science. So we don't want to go and just treat willy-nilly. We want to be thinking about what we're doing and be intentional with what we're doing. So yes, the dreaded photo that patients bring in with them. I actually stopped dreading the photo because I do think it's a way of communication. And so sometimes the patient doesn't know how to communicate their wants with me. So I can often draw out what they're looking for with a photo. But some of the challenges of photos are that we don't really change the shape of the lip with lip filler. And so I always have to tell a patient, you might love the way her lip shape is, but we're actually going to keep your lip shape and we're just going to enhance it so you like it better as well. So that's one thing. The second thing is when you do see an overfilled lip, a lot of times in clinic, I will sit down with a patient and tell them that my style is actually conservative and my goal is to keep them looking as conservative as possible. And unfortunately, it's sometimes easy to go too far. So there are often times where I have to tell the patients, this is enough lip filler. You don't need it today. Maybe we can talk about another area on your face that we can put some filler in.
Yeah, it's interesting over the years, like when Restylane was the first product that came out, we would see all of the marketing of the nose and down, and we would just see the nasolabial folds or the marionettes filled. And now we look at the face so much more differently. We look at it as like the global effect, sort of like what we did with Botox. We addressed those 11s really heavy, but then the muscles around it would give the Spock look, and we weren't looking at balance and proportion in the face. And now it's all about balance, proportion, bringing out your best asset and not throwing off that balance, right? So when should someone start looking at filler versus Botox? When is Botox going to stop being the tool for, building as part of the house? And when should they look at filler? Because one of the areas I see is when they have the forehead, like the forehead lines, and more Botox is just going to lower the brow. But we also don't really have filler in the forehead that we want to use safely. So how do you do a little bit of this and a little bit of that?
I love that question. It is so important to look at the overall face. And right now, I really believe it's a great time to be in aesthetics because there's so many things we can do. And we actually are making people look the best they actually can, in contrast to the early days where we were just effacing these nasolabial folds and it didn't necessarily look super natural in every single case. The beauty of someone who is consistent with their neuromodulator, meaning they're coming in every 3 to 4 months, we have these frequent conversations in that maybe a patient has started noticing the apples of their cheeks have flattened out, and they will mention it to me during our Botox visit. And because of that, I can address options with them that may not include neuromodulator. It may include some filler. And then we can talk about what filler can do and what Botox can do and the contrast between them. Also, it's very common for someone to really focus on an area. So for instance, if someone comes in and they have deep glabellar lines or deep frown lines, and they don't want to treat their forehead because maybe they have bangs at the time, or maybe they don't bother them, I will eventually, once I have their trust, talk to them about sort of blending our results. So again, not focusing on one area, but thinking of the face as being a global area, because it will look funny if someone has a completely smooth crease, but they have deep forehead lines, or smooth forehead, but very deep crow's feet. And so that's an area where an expert can kind of gently guide someone and respect their wishes, but also keep them looking as beautiful and as naturally striking as possible.
Okay, so what's the difference between filler and biostimulatory or collagen stimulating products?
Filler is a gel, and most fillers are made out of hyaluronic acid gel. So that's something that's found naturally in our own skin, and it, as you know, and it will go in and look so smooth and so beautiful. Biostimulators are things that stimulate collagen. And there is some overlap between the two because doing filler will stimulate a little bit of collagen, and there's a biostimulator called Radius that has some filler properties to it. So there's some overlap. And again, a lot of this is really nice to talk about in a specific consultation with a patient. But what's great about the biostimulators are they stimulate collagen, and therefore they last longer. And oftentimes, because of that, we're thinking of it in a more global sense of the face versus just spot treating an area. Many times I'm using filler to spot treat. biostimulator to treat the whole face.
And the filler, you get more of an immediate response, and the biostimulatory a little bit, and then over 3 to 6 months, you form more collagen.
Exactly. That's exactly it. So that could also be a decision maker, instant gratification versus waiting a little bit for the gratification, but having that to last longer.
I feel like it's so nice to do both at the same time because you're getting a little bit of result, but not enough for everyone around you to say what happened to you. And then over 3 to 6 months, you slowly look a little bit better.
I think that's the ideal scenario. The instant gratification really helps patients say, hey, I made this investment. I'm so happy I did. I immediately feel refreshed. But I personally love the feeling of every day I'm waking up a little bit better and looking a little bit younger than I did yesterday. That's a great thing about the biostimulators. They will not only peak at 6 months, but I believe that you get a little bit of benefit even beyond that.
Right. Okay, so let's talk about, let's first talk about locations of where people can look at doing fillers and biostimulators, because I don't think that people are even aware of all of the locations. Can you just kind of talk about some of the places you've done it, whether it's on label or off label?
Sure. Let's start from the top and go down. So the temples are a really common area for us to treat because what happens is over time they get hollow. We may not notice they're getting hollow, but as they're getting hollow, it's letting the eyelid skin sag down because it's not providing as much support as we used to have. And that's really the key, both with biostimulators and with fillers, really trying to put support back to where it used to be so the skin can drape as beautifully as it used to. So when we put filler or biostimulator into the temple, it will round out the upper face, which preserves the youthful proportions of the face. And then it will lift the eyes a little bit. So it's one of my favorite places. Moving down, we can absolutely put filler in the cheekbones, the outer cheekbones. And what that will do, it will pull from whatever volume loss the patient has had on the side of their cheek or around their jawline. So it will pull and put everything up. And we can continue the filler in towards the middle of the cheek. And I love treating the middle of the cheek because that will smooth out what we call the tear troughs areas. And it will also lift from the lower face and reduce jowls and reduce these nasolabial folds or these smile creases. So really, really great options there. Speaking of the tear trough, we can spot treat with filler here, usually after we've treated the cheeks. We can spot treat with filler in the nasolabial folds, not to efface them like you mentioned, but to soften them. We can treat the marionettes. We can treat the jawline of the face, and that's a really great area to really pull back from the jowl area to sharpen the profile of the face, which is really useful, and even to lift from the neck. And we can also put filler in the chin. Same thing. Tighten the jowl area from the front, pull from the neck, and enhance the profile of the face. So those are the areas on the face where I typically do filler. I think I forgot the lips, and we can also put a little bit in the nose as well to help with any curvature deficiencies and to make the nose just look more contoured as well.
Mm-hmm. And I know you do the neck and the back of the hands too.
Oh my gosh. Yes, of course. I'll just keep going. How much time do we have?
I know, right?
So I love treating the neck. I just had the treatment done to myself recently. Treating the neck with a mixture of the biostimulator and a filler is really, really beautiful. And that will do a few things. It will thicken the skin of the neck so that it will sag less over time and sag slower over time. And it will immediately pull it tight and also define the jawline. So anyone who has some thickness here, a little waddle, it's perfect for it. Really, almost anyone is a candidate for this. Backs of the hands are fabulous. The skin here is very thin, just like the neck skin is thin. And when I put a mixture of biostimulator and filler underneath, it immediately smoothens, but it will create some long-lasting skin thickening that is so youthful over time.
I love this. I want to make an appointment right now. Okay. As I'm sure everyone who's listening, right? Because there's such subtle little things that the way I look at this is over 10 years, if you do a little bit, whatever your budget allows for, over 10 years, you look a lot better.
Yes.
Than if you just wait and try to do everything at once where there's more side effects. So can you just talk about the potential risks of both the neuromodulators and then the fillers? Because people do need to understand there's risks involved in everything.
Absolutely. So with neuromodulators, the risk is actually very, very small if you are wondering about long-term risks, such as, will this get absorbed into my brain? Or will this cause any bodily harm? Will it lead to cancer, etc.? The answer is no. We have seen nothing that is concerning in terms of a long-term outcome with Botox and other neuromodulators. The risk is looking funny. So temporarily. So it can drop the brow. It can make you look expressionless. It can make you feel not like yourself. So it's just really important to start with someone you trust and have a relationship with your injector, because over time, that level of trust will lead to great communication and education, and you'll get the results you want. Regarding fillers, there is some risk with fillers. So when I'm talking to a first-time patient, I say, you probably want to know the worst case scenario. And the worst case scenario is usually scary. So the worst case scenario with filler is that the injector could accidentally inject into a blood vessel, and that can lead to either clogging of the blood vessel, leading to some scarring, or it could lead to some of the filler getting into the blood vessel and traveling to a vital organ such as the brain or the eyes. So blindness, even risk of stroke. It's very uncommon, but it has been reported with filler. And so it's really, really important to go to an injector that you trust, who will be conservative, and who is doing things to minimize that risk.
What qualifications should people look for when they're looking for someone?
I always recommend going to someone who has a lot of experience with the neuromodulators and with the fillers. In my opinion, a board-certified dermatologist or plastic surgeon is absolutely the best, because there's a lot of education that goes into the board certification and maintaining a board certification. But the non-negotiables would be experience of the injector and the maintenance of current certification, whatever that might be.
Right. And if you're in Scottsdale, Arizona or Phoenix, come see Dr. Lutowski. Well, I love how you do things, because you keep it natural and very global, from skincare to lasers, which we're going to be talking about in another episode. And it's a little bit of everything, because I look at all of this as building a house, as I had mentioned, and you can't decorate the upstairs bedroom until you have the foundation done. And it's one thing doesn't do everything. You need to do a little bit of everything in the most natural way that respects somebody's budget and their time, and that's what you do.
Thank you so much. And I feel so fortunate that we have so many tools in the toolbox, and we have the knowledge to treat patients safely and effectively and predictably. And thank you, Jen, so much for having me on. It's been really, really fun.
Thank you. How can people find you? At least on social, and we'll have all of your information in the show notes.
Thank you so much. So we are on social at Clear Dermatology, and also our website is cleardermatology.net. Thank you so much.
Thank you for joining us on Listen to Your Skin by Moon & Skin. It's an honor to be part of your skincare journey. And if you love this episode, make sure to subscribe, leave us a glowing review, and share it with someone who's passionate about their skincare journey. And please connect with us on social to ask your questions, which will drive future educational episodes.